Neurotransmitters are the chemicals that are released from the axon tip, at the terminal buttons. Imbalances in neurotransmitters have been linked with certain psychological disorders. No neurotransmitter works in isolation, so no psychological disorder can be traced to a single neurotransmitter alone. The effects of neurotransmitters depend in part on the nature of the receiving neurons. The following neurotransmitter substances play roles in psychological disorders depending in part on their nature and on the neural transmission process. Dopamine, involved in reward, motivation, and the executive functions of the frontal lobe, including body movements. Too little dopamine is linked to attention deficit, hyperactivity disorder and depression. Too much dopamine is linked to inappropriate aggression and schizophrenia. Serotonin, involved in mood, sleep, and motivation. Too little serotonin is linked to depression and obsessive-compulsive disorder. Too much may reduce motivation. Acetylcholine plays an important role in the hippocampus, where it helps to process new information in memory. Also found in the ANS and is involved in the fight or flight, or panic, response. Too little acetylcholine is linked to delusions. Too much can contribute to spasms, tremors, and convulsions. Adrenaline, or epinephrine, plays a role in attention and the body's fight or flight response. Too little adrenaline contributes to depression. Too much can lead to over-arousal and feelings of apprehension or dread. Noradrenaline, or norepinephrine, plays a role in attention and the fight or flight response. Too little contributes to distractibility, fatigue, and depression. Too much is implicated in schizophrenia and anxiety disorders. Glutamate, involved in registering pain and forming new memories. Too little glutamate is associated with schizophrenia. Too much is linked to substance abuse. Gamma-aminobutyric acid, GABA, inhibits brain activity in specific areas. Too little GABA is associated with anxiety and, possibly, panic disorder. Too much appears to undermine motivation. Endogenous cannabinoids, involved in emotion, attention, memory, appetite, and the control of movements. Too little is associated with chronic pain. An excess is associated with eating disorders, memory impairment, attention difficulties, and possibly schizophrenia. Neurotransmitters and drugs. There are several different types of neurotransmitters released by different neurons, and we can speak in broad terms about the kinds of functions associated with different neurotransmitters. Table 1. Much of what psychologists know about the functions of neurotransmitters comes from research on the effects of drugs in psychological disorders. Psychologists who take a biological perspective and focus on the physiological causes of behavior assert that psychological disorders like depression and schizophrenia are associated with imbalances in one or more neurotransmitter systems. In this perspective, psychotropic medications can help improve the symptoms associated with these disorders. Psychotropic medications are drugs that treat psychiatric symptoms by restoring neurotransmitter balance. Psychoactive drugs can act as agonists or antagonists for a given neurotransmitter system. Agonists are chemicals that mimic a neurotransmitter at the receptor site and, thus, strengthen its effects. An antagonist, on the other hand, blocks or impedes the normal activity of a neurotransmitter at the receptor. Agonist and antagonist drugs are prescribed to correct the specific neurotransmitter imbalances underlying a person's condition. For example, Parkinson's disease, a progressive nervous system disorder, is associated with low levels of dopamine. Therefore, dopamine agonists, which mimic the effects of dopamine by binding to dopamine receptors, are one treatment strategy. Certain symptoms of schizophrenia are associated with overactive dopamine neurotransmission. The antipsychotics used to treat these symptoms are antagonists for dopamine. They block dopamine's effects by binding its receptors without activating them. Thus, they prevent dopamine released by one neuron from signaling information to adjacent neurons. In contrast to agonists and antagonists, which both operate by binding to receptor sites, reuptake inhibitors prevent unused neurotransmitters from being transported back to the neuron. This leaves more neurotransmitters in the synapse for a longer time, increasing its effects. Depression, which has been consistently linked with reduced serotonin levels, is commonly treated with selective serotonin reuptake inhibitors, SSRIs. By preventing reuptake, SSRIs strengthen the effect of serotonin, giving it more time to interact with serotonin receptors on dendrites. Common SSRIs on the market today include Prozac, Paxil, and Zoloft. The drug LSD is structurally very similar to serotonin, and it affects the same neurons and receptors as serotonin. Psychotropic drugs are not instant solutions for people suffering from psychological disorders. Often, an individual must take a drug for several weeks before seeing improvement, and many psychoactive drugs have significant negative side effects. Furthermore, individuals vary dramatically in how they respond to the drugs. To improve chances for success, it is not uncommon for people receiving pharmacotherapy to undergo psychological and/or behavioral therapies as well. Some research suggests that combining drug therapy with other forms of therapy tends to be more effective than any one treatment alone.